Welcome to China Reporter. COVID-19 epidemic, a disaster that has terrified the whole world for more than 3 years. Millions of cases of the disease recorded in one day. Uncountless died people. The economy and society of all countries affected. These hauntings only partly represent the impacts of the COVID-19 epidemic on the world. And the origin of this fearful virus comes from a place that is not strange at all, and that is China. Gradually, the epidemic was controlled, so everyone thought this nightmare had come to an end, but we were completely wrong. That is just the beginning of other nightmares, and its creator is China. In recent months, reports of a mysterious respiratory illness emerging in China have sparked concern and speculation worldwide, with memories of the devastating COVID-19 pandemic still fresh in our minds. Fears of a potential resurgence or a new variant have intensified. As experts scramble to unravel the mysteries surrounding this strange disease, questions abound. Is this the precursor to a second version of the COVID-19 epidemic? Are we on the brink of another global health crisis? This is what's happening right now in China's major hospitals. Hospitals become overloaded with a huge number of patients. The hallway was filled with people lining up to be examined. Patients presented with symptoms reminiscent of COVID-19, including fever, cough, and difficulty breathing. China's National Health Commission, the first case of an unknown pneumonia on the 13th of November 2023. Since then, there has been a spike in cases, most of them resulting in hospitalizations. The first whispers of the strange respiratory disease surfaced in China's Hubei province, the initial epicenter of the COVID-19 outbreak. The pressure from the media was increasingly big. It made China's Health Commission put an announcement about the outbreak on November 26, 2023, saying that the recent outbreak involved 7 pathogens, with Mycoplasma pneumonia being the more serious condition. In other words, it's officially announced that 7 viruses are now circulating in China. The new virus has already hit several schools in China, but the government claims that no unusual or novel pathogens have been detected yet. The main victims of this disease are children, because children have weak resistance and are most susceptible to infection, and the surge has sparked a rush to hospitals by anxious parents, putting top pediatric medical centers under strain. Pictures of overcrowded hallways and children on intravenous infusions have gone viral on Chinese social media. In the hospital outside, some adults are said to carry campers and yoga mats as to have a place to lay down the children in view of the highly contagious nature of the disease. Some parents have also called for temporary school shutdowns to prevent the spread. Several cities, including Beijing, have released official directives asking educators and learners not to report sick to work or class. In order to prevent repeated trips to the doctor, schools in Jiangsu and Guangdong provinces have already implemented a temporary precautionary and control step, wherein they have suspended classes for the entire class and asked students to rest at home. When covering such news, the official media has purposefully maintained a low profile. For example, a first-grade class at an elementary school was suspended for 4 days with only a few media outlets reporting the news. The school's announcement stated that illness, primarily influenza and fever, was the reason for the class's suspension. A third of the students were absent. Therefore, this class was suspended for 4 days as mandated by the local government, despite the official media downplaying it and notifications about school closures being posted throughout various parts of China. Hospitals in northern China and Beijing have reported a surge in the number of children with respiratory illnesses, including pneumonia. Before the serious situation, the World Health Organization asked China to provide more information on the cases. On the 21st of November, 2023, the Public Disease Surveillance System ProMed issued a notification about reports of undiagnosed pneumonia. The alert, based on a report by Taiwanese outlet, said children's hospitals in Beijing and Liaoning, 500 miles apart, were overwhelmed with sick children. This outbreak is said to be mainly in the capital, Beijing, but also in the northeastern Liaoning province and other areas in China. In an interview with the media company, Mr. Wei, a Beijing citizen, said, Many are hospitalized. They don't cough and have no symptoms. They just have a high temperature fever, and many develop pulmonary nodules. Many reports from hospitals suggest a widespread outbreak of an undiagnosed respiratory illness. It is not at all clear when this outbreak started, as it would be unusual for so many children to be affected so quickly. The report does not say that any adults were affected, suggesting some exposure at the schools. A Beijing children's hospital told CCTV, Chinese state media, that at least 7,000 patients were being admitted daily to the institution, exceeding capacity. The largest pediatric hospital in nearby Tianjin also reportedly received more than 13,000 children at its outpatient and emergency departments in 1 week. Another major hospital in Beijing has reported that, on average, every day they are seeing about 1,200 patients enter their emergency room. Based on what is known thus far, how concerning are these cases? Why might there be a surge in respiratory illnesses? Should people traveling to China rethink their plans? What additional precautions should governments, health systems, and individuals take? To help us understand the situation, a wellness medical expert, Dr. Liana Wen, revealed many information related to this health situation in China. Dr. Wen is an emergency physician and professor of health policy and management at the George Washington University Milken Institute School of Public Health. She previously served as Baltimore's health commissioner. She added, "Thus far, based on what we know from WHO, I don't think the spike in respiratory illnesses should cause global concern. What would be most worrisome to the international medical community is if a new pathogen is emerging, as it did in the form of COVID-19 in the winter of 2019. This does not appear to be the case now." Not only Dr. Wei, but many professionals also have the same opinion. Foreign medical experts believe that Mycoplasma pneumonia can be easily cured with commonly used antibiotics over the past few years. Beijing had an obviously poor track record of covering up outbreaks, so outsiders are wary of what virus is causing China's hospitals. Especially children's hospitals are overcrowded. Doctors in China have been saying that there is no cure for upper respiratory tract infections. This has shocked many who can't believe that there isn't a cure, thus fueling speculation among medicine that the current virus is probably a variant of the new coronavirus. What has China said about the outbreaks? Chinese authorities said the rise in respiratory illness was partly due to COVID-19 restrictions being lifted. In the winters after pandemic measures lifted in the UK, there was a surge in illnesses including flu, RSV, and strep A, as people mingled more after winter seasons where illnesses had been suppressed by people staying home and wearing masks. China dropped its COVID restrictions much later than many other countries, scrapping testing and isolation rules last December. Authorities also said the spike was due to known illnesses circulating, including flu, RSV, COVID-19, and Mycoplasma pneumonia, a common bacterial infection that typically affects younger children. The cold weather has also played a part, according to Chinese authorities. As temperatures plummeted in Beijing, in northern China, the capital entered a high-incidence season of respiratory infectious diseases. Wang Quanyi, deputy director and chief epidemiological expert at the Beijing Center for Disease Control and Prevention, told state media. China has said it has found no unusual or novel diseases and has maintained the spike in infections has not overloaded hospitals. Chinese health authorities have said the rising infections are a mix of already known viruses and are linked to the country's first full cold season after strict COVID restrictions were lifted last December. Symptoms included fever, lung inflammation without a cough, and pulmonary nodules, lumps on the lungs that are usually the result of a past infection. No deaths have been reported. At a children's hospital in Beijing on Thursday, several parents told AFP their children had Mycoplasma pneumonia, which is a common cause of pneumonia in children that is readily treated with antibiotics. Mycoplasma pneumoniae is a bacteria that typically causes a mild infection, with symptoms that are similar to a common cold. It rarely requires hospitalization, but sometimes a cough could last for weeks, and younger children with a nascent immune system are at greater risk of developing pneumonia. Before the emergency situation of China, The WHO has made an official request to China for additional epidemiologic and clinical information, as well as laboratory results from the reported outbreaks among children. A report of the meeting issued by the WHO said multiple viruses, influenza, respiratory syncytial virus or RSV, and adenoviruses, as well as Mycoplasma pneumoniae, one of the bacterial causes of pneumonia, have been circulating in China for weeks, or in the case of Mycoplasma pneumonia, months. While the timing of the circulation is unusual in some cases, the illness being observed is not. Chinese authorities advised that there has been no detection of any unusual or novel pathogens or unusual clinical presentations, but only the aforementioned general increase in respiratory illnesses due to multiple known pathogens, the WHO statement said. They further stated that the rise in respiratory illness has not resulted in patient loads exceeding hospital capacities. The WHO statement concluded that with the arrival of winter weather, cases of these illnesses will likely continue to increase and could strain hospital resources. It noted that Mycoplasma pneumonia is easily treated with antibiotics. Reports of high levels of respiratory illnesses among children in China appear to have sounded disquieting echoes of the start of the COVID-19 pandemic in some quarters. That disease, caused by the SARS-CoV-2 virus, began in China sometime in late 2019, hitting the greater world's radar around New Year's Day 2020. The WHO, which was pilloried at the start of the COVID pandemic due to a perception that it should have taken a harder line with less than forthcoming Chinese authorities, was quick to formally seek information from China, making the request under the auspices of the international health regulations. The IHR requires countries to alert the WHO of disease outbreaks that could threaten to spill across borders. The emergence of a strange respiratory disease in China has reignited fears of a potential second version of the COVID-19 epidemic. While the situation remains shrouded in uncertainty, one thing is clear: swift and coordinated action is essential to contain the spread of the disease and prevent a global health crisis.